Five more persons who returned from Chennai have tested positive for COVID-19 today, taking the state's tally of active cases to 9. 6 patients are undergoing treatment at Dimapur, 2 at Kohima and 1 at Tuensang. COVID-19 recovery rate improves to 42.45% in the country, with a total of 64,426 people affected with coronavirus having recovered. Total number of cases stand at 1,51,767. And 18 new cases of COVID-19 have been reported in Assam, taking the total confirmed cases in the state to 704, including 62 recoveries and 4 deaths. Well, hello and welcome to News and Trends, and you're watching the Daily News Bulletin. 5 more persons who returned from Chennai have tested positive for COVID-19 today, taking the state's tally of active cases to 9. Nagaland Health Minister Pang Yupom posted on Twitter this morning saying that all the positive persons are now undergoing treatment at the COVID hospitals in Kohima, Dimapur and Tuensang. In another tweet, the minister said one inbound passenger to Tuensang who was released yesterday from Kohima Quarantine Center has tested positive. His result came out this morning. Contact tracing are in process and the patient is being taken care by Tuensang medical team. As on 27/5/2020, 6 patients at DHT, 2 at Kohima and 1 at DH Tuensang, the minister tweeted. Now yesterday the minister also tweeted saying the positive case of COVID-19 was anticipated. We knew that this deadly virus will not spare our state when we decided to bring all returnees back. Let us stay positive and fight this pandemic together. Do not discriminate the frontline workers and do not panic because together we can. According to DIPR, on 27th May 2020 at 4:45 am, 5 buses carrying 151 persons, all returnees from Chennai, arrived from Kohima at Tuensang College Quarantine Center, Tuensang, and were admitted after necessary procedures were followed. The samples for COVID-19 testing were taken at Kohima before being sent to Tuensang, and results were awaited. At 7 am today, report of a person being tested positive for COVID-19 was received from the State Nodal Officer IDSP Kohima. Consequently, the person was isolated at the quarantine center, and in the meanwhile, the district hospital Tuensang was activated as a COVID hospital by shifting the regular patients to Urban Primary Health Center PHC Longpang and Polyclinic. The person was then shifted to the COVID hospital isolation ward and is being monitored as per the SOP. As per the latest report, the person is stated to be asymptomatic and in a stable condition. It said more test results are awaited. Meanwhile, the Tuensang District Task Force for COVID-19 had an emergency meeting at DC Conference Hall Tuensang today. In the meeting, the Deputy Commissioner Kumar Ramnikant declared that one positive case detection amongst the returnees of Chennai, but asked all not to panic. The general patient of Tuensang District Hospital was shifted to Longpang PHC and Urban Center Tuensang. Tuensang Government College Quarantine Center has been declared as containment zone and every detailed protocol shall be maintained. The security and management matters in the quarantine centers were also discussed. It also discussed to segregate the inmates of the JNV Chare to Longkim in zone-wise. Meanwhile, in view of the detection of one positive case of COVID-19 among the returnees from Kohima quarantined at Tuensang College Quarantine Center, Deputy Commissioner Tuensang Kumar Ramnikant has declared the entire campus as containment zone as per SOP. The Health and Family Welfare Ministry has said that a total of 64,426 people affected with coronavirus have been cured and the recovery rate has reached 42.45% in the country. During the last 24 hours, 3,935 people have recovered and 6,387 fresh cases of COVID-19 have been reported, taking the total number of cases to 1,51,767. Health Ministry said 170 deaths have been registered in last 24 hours, taking the nationwide total 4,337. According to the ministry data updated in the morning, the highest number of confirmed cases in the country are from Maharashtra at 54,758, followed by Tamil Nadu at 17,728, Gujarat at 14,821, and Delhi at 14,465. 18 new cases of COVID-19 have been reported in Assam, taking the total confirmed cases in the state to 704, including 62 recoveries and 4 deaths. Assam Health Minister Himanta Biswa Sharma said in a tweet, "Alert, 18 new cases of COVID-19 positive, including first air carrier, a resident of Kamrup Metro who travelled from Ahmedabad to Guwahati, 14 from Golaghat, 2 Karbi Anglong, 1 Lakhimpur." The deadly disease has claimed the lives of 4 persons so far in Assam, while 3 cases migrated from the state. There are 635 active cases in the state as of late afternoon today. Arunachal Pradesh Chief Minister Pema Khandu has appealed to the people of the state to strictly follow the guidelines of the lockdown and support the government in fighting the COVID-19 pandemic. He said that there are possibilities that the state may have more COVID-19 cases in the coming days, but the people of the state should not panic and instead be mentally prepared for it. He said the government is well prepared and equipped to handle any situation with regard to the virus. Arunachal Pradesh currently has 1 active case of COVID-19.
अच्छी तरह हम लोग ने बनाया हुआ है। इंस्टीट्यूशनल क्वारंटाइन फैसिलिटी से लेके हमारा कोविड केयर सेंटर, इसके बाद हमारा डेडिकेटेड कोविड हेल्थ सेंटर से लेके हमारा स्टेट कोविड हॉस्पिटल तक हमारा एसओपीज पूरा तैयार है।
Across the globe, 54.84 lakh people are infected with the coronavirus and global death toll reaches 3.5 lakhs. Various countries begin to relax restrictions on activities. Several European nations deliberate on opening up borders. The United States is approaching a grim milestone as the coronavirus death toll approaches 1 lakh people amid the ongoing global scramble to contain the virus and find a vaccine. Currently, the death toll for coronavirus cases across the United States is more than 98,000 people. Brazil deaths by COVID-19 reached 24,512 yesterday, with 1,039 new deaths over the last 24 hours. The Health Ministry said the number of infections in Brazil rose to 391,222 with 16,324 new cases. Russia said on Tuesday that 174 people with the coronavirus had died in the past 24 hours, a record one-day amount that pushed the nationwide death toll to 3,807. Officials reported 8,915 new cases on Tuesday, pushing its overall case tally to 3,62,342. The Spanish government declared a 10-day official mourning period from Wednesday to honor the nearly 30,000 people who died from the coronavirus pandemic in one of the world's worst-hit countries. During the mourning period, flags will fly at half-mast all over the country's public buildings and navy ships. France's coronavirus death toll rose by less than 100 for the 6th day, raising hopes that the worst of the pandemic is over for the country. In a statement, the French Health Ministry said that the number of new confirmed cases was up by 0.2%, in line with the rate of the last week and slower than the week before. In Assam, new areas are inundated due to the breach of embankments and roads. Several rivers are flowing above the danger level. Over 2 lakh people have been affected in the first wave of floods in the state. NDRF and SDRF teams have been deployed at Golpara district for relief and rescue. 9,000 people have been shifted to relief camps at Golpara and Tinsukia districts. Floodwater also damaged over 1,000 hectares of crop area. Train movements are also affected at Lamding, Badarpur division for a brief period due to landslides, but will resume following completion of relief work. Minister for Planning and Coordination Niba Kronu has informed that the state government has taken the decision to establish a BSL-2 testing laboratory in Tuensang district headquarters. In his daily briefing on COVID-19 status today, he said that the state government through medical department will undertake necessary procedures for technical clearance for establishment of the laboratory from the Government of India and the Indian Council of Medical Research ICMR. The state government has also taken the decision to set up TrueNat testing facility in all the districts of the state. He also informed that the state government has taken a decision that all the stranded citizens outside the state who return to Nagaland will be tested for COVID-19 and they will proceed to the respective districts only after the results of the tests are made available. Even positive cases will be returned to the respective districts as each district has established COVID-19 hospitals. He said positive cases will be transported to respective districts following all safety procedures and norms. He said till date a total of 1,506 samples have been tested. Results of 1,187 samples have been received, out of which 9 are positive. Results of 319 samples are awaited. Through the TrueNat testing machine, so far a total of 48 samples have been tested and 47 have come negative, while the result of one sample is awaited. The minister also informed a special train from Jaipur carrying about 370 stranded persons of Nagaland is reaching Lumding at around 7 am tomorrow, and the passengers thereafter will be ferried to Nagaland by buses. Another special train is scheduled to move out from Goa on the 29th of May 2020, carrying about 645 stranded persons of Nagaland along with stranded persons of the other northeastern states. This train is expected to arrive Dimapur on the 1st of June 2020. Principal Secretary Home Abhijit Sinha has informed that a meeting was held today under the chairmanship of Chief Minister Nagaland regarding the inter-district transfer of returnees from other states to Nagaland. In the meeting, it was decided that returnees bound for other districts who are initially quarantined at the quarantine facilities at Dimapur and Kohima shall be sent to their respective districts only after conducting the COVID-19 tests on them and after obtaining the results. The Health and Family Welfare Department shall inform the status of the tests of the returnees to the Kohima and Dimapur District Task Force on time, and the districts will make the travel plan accordingly. There should be proper coordination between the sending and the receiving districts along with arrangements for necessary refreshments en route if required. The project directors, the RDA of the districts falling on the way may be assigned with proper instructions for making the arrangements for the refreshments or the food. The plans for sending the returnees to the districts should be prepared at least one day in advance with proper intimation to the concerned minister, advisors who have been assigned districts to monitor, the war room and the empowered group for better coordination. The government of Nagaland has informed that there is a fake circulation on social media about a train from Bangalore to Dimapur. It has asked all concerned to always verify source of information from an authentic government source. Nagaland Governor R.N. Ravi today had a meeting to review the preparedness of the state in the backdrop of recent positive cases reported in the state. A Raj Bhavan tweet said he laid emphasis on rigorous contact tracing and stressed the need for more BSL labs in the state. As part of its preparedness to facilitate the functioning of the Nagaland Legislative Assembly Secretariat in the COVID-19 pandemic situation, Secretary NLA Dr. P.J. Anthony has informed that it has installed an automatic body sanitizer at its main entry door. The sanitizer developed by the Kuda Tech Skill Center Dimapur was set up along with the automatic hand sanitizer dispensers in the context of the series of meetings of the Assembly committees scheduled in the coming days. The Public Accounts Committee under the chairmanship of K.T. Sikalu, MLA and Advisor School Education, had its first meeting of the year in the Assembly Committee room today. The Mon District COVID-19 Task Force has launched a mobile van for collection of COVID-19 samples. Considering the logistics and time involved in collecting the nasal throat swabs, The mobile sample collection van ensures that people do not have to travel to the COVID-19 hospital to have their samples collected. The mobile sample collection van helps guarantee the safety of the health workers and reduces the use of PPEs, as the doctor or the lab technician collecting the sample from outside the mobile van do not have to wear PPEs. This initiative will supplement the COVID-19 walk-in sample kiosk sample collection booth already in place at the district hospital Mon. That brings us to the end of this broadcast. Thanks for watching. Do subscribe to us on a YouTube channel and also follow us on Twitter and Facebook as well. Stay home, stay safe, and take good care of yourself. From all of us here, it's bye for now, and thanks for watching.